YouTube comments from a video titled, Millions of Americans Just Got Screwed Out of Healthcare. Part 6.
At Wanderlei Silva 29 wrote,
LL insurance is bullshit. Just save money only to use when you go to the doctor. Unless you have cancer or AIDS, y'all save a shit ton of money.
At Salt and Pepper 1963 wrote,
18 years experienced RN, make redonkulous money. I focus on a healthy lifestyle and only sign up for the cheapest high-deductible insurance plan through my hospital/employer. I'd rather keep more of my paychecks to invest and pay off house. Most people are over-insured out of fear.
At Ridge Midnight wrote,
The lowest ObamaCare tiers are $50 a month for low-income families, so Democrats are full of shit. The only people it affects are the people in top tier plans that can pay $360 a month, so it doesn't affect low income at all. And have Democrats explain how Medicare jumped 40% under Biden and why are illegals getting the most at the top and Americans are like 10th in the list of recipients. If you cut off all the legals from Medicare, the ones here for a better life, Democrats tell you the cost in the billions a month would drop 70% in cost. Think about that for one moment.
Edge Flowers 8913 wrote,
It worked out for me and my wife. Having a kid and her surgery right after for complications. Insurance paid out $185,000. I paid $6,000. They lost money on us.
At Booty 9822 wrote,
This ALL started when ObamaCare came around. I saw the bill for my head being gashed open to the skull with 27 stitches, 1 PO and T2K. Emergency room BTW.
At Ryan Patrixtily 6969 wrote,
I live in MD, and I just got fucked by Medicaid because their digital-only form pauses is crazy retarded, but most people have problems because of the PPO programs that the ACA put in place. Insurance was totally different. Before, yeah, it was still expensive, but I've only been on Medicaid for 2 years, and I've had 2 fake or illegal doctors be my preferred physician. Don't know how they're on the state list.
Some_Birdman wrote,
You all can thank President Obama for the Unaffordable Health Care Act that has bankrupted the healthcare system. You moronic Democrats purposely collapsed the industry and now it needs life support to keep it going. Yet another failed Democrat policy.
Thyred wrote,
Yep, I pay $302 biweekly for me and my family. Still have to pay high deductibles and copays. Still have to pay a fee at the pharmacy. Not sure what to do, and the $302 biweekly is going up after enrollment season.
At Zach Hunt 123 wrote,
Virtually every aspect of the U.S. is to make absurd amounts of money, even if that means profiting off someone's health. Any rational government should be incentivized to ensure a healthy population, but instead the focus is on how rich someone can get. No other developed nation has healthcare costs like the U.S. There's usually some form of public health insurance funded by government. It's not always adequate, but better than nothing. I believe doctors and other medical staff should be paid well because their services are important. I don't believe health insurance companies should be near as wealthy as they are. I honestly don't care for their continued existence.
At Fletch Lives 247 wrote,
So many have been injured by the death poke that they will feel compelled to pay whatever to try and figure out what's wrong. Of course, many are oblivious to the damage they have caused themselves. It's like the opposite in communist Canada, where they will offer you free Maid's healthcare and then use your organs for the transplant business cashing in.
At 5541 James wrote,
In November of 24, my broker called and said the rates are going up 14%. We have CBS Silver plans for everyone, so in 26 it's going to triple? I hope not, because that would take our monthly payment from $5,500 to $15,000 plus a month. We pay for all our employees' health insurance 100%, so WTF, that amount is not sustainable. We may have to look at HSA accounts at that point.
At Annie Hills 3580 wrote,
I have a rare disease with no cure. I am tired of inept doctors and sky-high medical bills. I am going to make my own pain med with wild grass and say goodbye to big pharmaceutical companies.
At Gringo 5516 wrote,
I've worked for the same company for 29 years. The first 10 years, I never signed up for insurance with my employer. I didn't go to a doctor for any reason until after about 15 years. If a person doesn't have chronic health problems, just pay $100 out of pocket once a year to a doctor to get looked at. If you get injured, every county hospital nationwide has to see you. Same thing all the illegals do. When I was kid, my parents never had me on insurance. I got bad flu a couple times, and they just took me to end and paid for the visit. I'm 54 now. No health issues. I don't take any pills. I do sign up for insurance now. I just get a cheaper plan that costs me about $200/mo out of pocket. That's $2,400/year. All I do is go to a doctor once a year, so I'm losing money. Since I'm older, I figured I'd buy some insurance in case I break a leg or something. I might not sign up next year. I'm tired of paying $2,400/year for nothing. Most people don't need insurance if they're healthy, especially young people. I'd say half my coworkers near my age never even go to a doctor. I have one who's 50, and he has never been to doctor. He's in great shape, works out, and only eats real good.
At James 1914 wrote,
Start praying to God, people. Time to trust Jesus. Be your own doctor. Eat better food. Treat your body like a temple. Read books on health and nutrition. The medical cartels are not going to give you proper treatment at the hospital or doctor's office. They only want to poke you with poisonous fluids and drugs that give you side effects that end up hurting you more.
At George 6636 wrote,
Am poor and broke and can be homeless at any time, so if I die not going to see a lean pos doc, take them pills and shove it, I'm good.
At Patricia McDowell 9268 wrote,
This is the way it's been since Obamacare started. I stopped going to the DR altogether. It was okay. Not 100%, but okay. After Obamacare, everything doubled. You used to be able to pay for a major medical insurance, or not have maternity benefits if you didn't need them.
At Random Hodgepodge 8902 wrote,
That first lady that blames Trump for the increase. So that means, before Trump, healthcare was free? I want my money back. It is always a gamble. Any kind of insurance is a gamble. You may need it, you may not need it. You may live if you get hooked on their RX you allegedly need, or may die because of the RX they gave you, or you may die anyway. And just because you have insurance and you are able to pay for it doesn't mean everything is 100% covered. Buy only what you think you can afford and will use. Otherwise, say no to the gamble. Change your diet, eat healthy. Healthy lifestyle, your chances of needing a doctor just drastically went down.
At Daniela 8400 wrote,
Paying cash is cool until you get a major illness. I thank goodness I was active duty military during my cancer diagnosis. I had 8 surgeries, multiple other treatments, and 5 years later, I'm still in need of another surgery. VA will cover my surgery, but I can't afford to stop working right now.
At M3LTUP wrote,
If you go W/O, healthcare in CA, the state will hit you with a $1,500 penalty. So on top of losing your job, you gotta pay another tax. Thank you, Democrats.
At Lori McMahon 407 wrote,
Blue Cross Blue Shield is 991 po in T62 a month for self plus family. This does not include dental or vision. Guess we'll have to switch to some sort of high deductible plan.
At Pookie 4660 wrote,
People don't vote against government spending. It takes 6 months of work to pay off your taxes. I imagine what you could do with that money. Even half back. Yet all politicians and their families get wealthy.
At SS or 7MZ wrote,
6 yeah. And she didn't even mention the $1,000, $2,000 deductible yet. It's FN horrible. I'm currently in open enrollment and considering dropping that S2.
K Hunter 90 wrote,
Health insurance is really only worth it if something big happens. Just like auto and home insurance. It's a gamble if you don't have it, but you could literally pay in for years and years and never use it at all. I had a period of over 20 years where I didn't go to a doctor at all. I just didn't feel the need to, even though I had insurance.
As Sharon Sullivan Q2K wrote,
Some of us have no choice. My pregnancy destroyed my pancreas and pushed me into type 1 diabetes. Now I make no insulin. So I have to have insurance to cover the cost of insulin. Things happen that are unpredictable. Some people become type 1 from the flu or even COVID. It's all if you carry the gene for it. I unfortunately can't go full self-pay. If you end up in the hospital, those bills are very large.
At Organic Thug 5220 wrote,
As a health-conscious person, going to the local Kroger is a nightmare. Parentheses 90% of the store is inedible diabetic heart-busting bullshit. Only on the outer edge you have a chance to dig through and find the organic option. Have to go to the Gucci store of food to find halfway decent healthy food. Health food stores. Only the ballers can afford it. Issue is poor people are pushed into eating cheap trash. The government arca regular working folks have to pay for it. So if each person paid their own way, could be different. We need everyone to have access to healthy food. Rich or poor. I don't want anyone unhealthy. Maybe someone does though.
At JRH 6025 wrote,
THE cost OF living ISO UTOF control. Oh, and everything YOUBU YIS outrageous IN price. I wouldn't bring kids into this world. Married couples that ALE having a hard time making ends meet don't think about bringing IN babies in this world. IF things don't get better, your kids will struggle IN life. AS time goes ONITS getting worse.
At Lashonda 8977 wrote,
Improve your health by improve your lifestyle. Eat organic and locally grown foods. Drink water in glass bottles. Be physical active each day. Sleep 7 to 9 hours per day. Take vitamins from reputable makers. Stop smoking and drinking. Get to know your body for yourself. If something is off, then go to the doctor immediately, even if it's a community clinic. Most people rely on health insurance to fix their poor lifestyle.
At David Richard 241 wrote,
My current affordable Medicare supplement policy is being cancelled by the carrier deck. 31 if I can find a comparable plan, it's gonna seriously cost me. And I lost my substantial pension somehow in that 2008 bank thing. I'm still pissed about that.
At the All Suave Mr. Toast wrote,
I have a friend who works in UK NHS. You have to wait 2 months to get an appointment with a doctor. And in Germany, they give you tea for many illness, not real medicine. So good luck with your free healthcare. And Jack is right, they take 50% or more of your check.
At a human 7199 wrote,
We have a society of crippled geriatrics being voted by such and the sickly who want to force the rest of us to fork over 50% of our paychecks to pay for their bills. I go to the doctor/dentist maybe twice a year.
At Let's Get Money 1183 wrote,
Most people do need dental work, especially in poorer demographics. Nobody is teaching you to floss daily and brush twice a day. Not even your parents. Oral health takes serious discipline.
At Zebra 66 wrote,
My health insurance only covers conditions I don't have. No doctors or hospitals in a 1,000-mile radius are ever in my network apparently, and they never tell me this until after I've been treated. The copay on medications with my plan is usually 3x the total price if I had no insurance at all.
At a Rink 3105 wrote,
It's sick here. We're paying all this money for them to jab you and give you pills that keep you sick. Get out of the system. It doesn't heal or cure you. It makes you sick and makes money off of you.
At STQL3VH wrote,
It is possible to get good health care. It's wrong thinking to say DRS/nurses are in it for the dollar. Nurses get a set wage, and any DR whose hospital or office has been bought by Wall Street also gets salaries. The bulk of the dollar goes to 1. Shareholders, and 2. INS companies. There are the shadow business behind this, the people who collect the ends payments, cut the mafia hospital coverage deals for said ends, and are the self-appointed paper pushers. ALL with business degrees. None with medical degrees that clear ALL payment from ends cause for anything you need from a DR. I.e., your DR says you must have X procedure, and the ends code denies it as an OT necessary and won't pay for it. If ends companies were out of business, ALL medical costs would go down. Hospitals/DRS would all do their own billing again. No crazy paperwork. Cuss no filing ins claims. Just straight billing. That's just for a start. Also, if universal health care were a thing everyone could have one real. Draw blood at sea. Physical a year for free to catch anything starting. All free vax IFYOU10NE. Beyond mandated real vax. 1 free dental clean/after ear. 1 free eye check a year. All that alone should keep most people with common sense at their own health and how they can maintain it, not needing any more than that for all their medical needs. There are people who need a lot of help for their issues, but W/O the ends it would be cheaper for them in the long haul. Cuss ALL ends let's makes. Hospitals send you home to die in the end. After they suck all he dollar they can out of you, you're just an empty orange husk ready to toss out.
At Christina Hall 7118 wrote,
You have to take in account that countries that offered health insurance and are taking that much out of your paycheck also offer excellent education systems, tuition-free ALLTHEWAYTO collage.
At Tron Colsto E9N wrote,
Jack, come down here to the Dominican Republic. It will cost you a fraction of what you have to pay in the US for dental work. More and more Americans are coming down here each year for dental procedures. You will only hear about bad things from dental here since the propaganda you guys are fed are strong. A plane ticket down here is cheap. Stay at a decent place and fix your teeth. Ask around for those who has visited a decent dentist down here. Backyard dentists doesn't count.
At Kevin 7151 wrote,
Given my own experience and observations, most people do not consume significant healthcare until they are 50 and beyond. In light of this, I would recommend most folks south of 50 to forego the healthcare costs and basically pay out of pocket. In addition, most medical offices and dentists will reduce the cost of services if one pays cash. You just need to ask before you consume the services.
TL Kletz wrote,
Does anyone know the Medicare has 200 PO and T00 premiums and you can't cancel once they put you on it? I will say I had a complete knee replaced and it was over 76,000. So there is that to think about. Get your insurance before you turn 50. It will save you a bankruptcy.
Jimbel VV3QV wrote,
I live in Canada and haven't had healthcare in 3 years. Only new immigrants have a doctor and they are still taxing me, but do not have a doctor. You can interview me, I will give you the gospel on Canada.
A Stone Fetish wrote,
Haven't had insurance in 25 years. It's been ridiculous. Forever last I checked was about 10 years ago to add. Only me to hubbies had to pay $700 for a wife and up to 4 kids could not apply as added only one person.
A Seth Facundo wrote,
I love how you don't know shit and just make estimation when you have a sidekick that can look up facts right there. NAM Medicare for all is cheaper than private insurance, as one, you cut out the middleman, and two, you have infinite more bargaining power with all 350 mil of Americans than you do on your own. Oh, taxes are going to go up. Actually, all we need to do is a marginal tax rate on billionaires and 100 millionaires, and everything is funded for as far as the eye can see. But instead, let's cut billionaire taxes and give them socialism welfare in the form of government subsidies, aka our taxes, so they get richer. And you have the peasants fight with each other like they're the problem. Oh, how will we ever do Social Security? Well, look back on FDR's terms and see. Or just go with our first gut reaction, as it is always surface level where you can squint your eyes, and an average Joe like you can see clearly still.
Atlana Vaver wrote,
I worked in the health insurance industry and can verify you should just insure yourself. If you're a normal healthy person, just tossing $800 a month, $9,600 annually, into a high-interest savings account is a good idea.
At Elizabeth Abril 938 wrote,
Have a meeting next week at my employer because they have a new health insurance called ICRA. We basically have to shop for our own health insurance. Funny thing is our benefits manager can't help us with any of it. I pay about $300 a month for myself, but have a high deductible which sucks. I'm healthy and have no kids. Just do my annual checkups every year and take birth control. All which are free. No co-pays. All insurance is a scam, but big corporations gotta make their profits. And we're paying for people living off the government. Just as bad as property taxes when you pay off your house.
At Idunomang wrote,
If you ever need major surgery, it's 100 grand. Good luck, everyone. That was the number on my bill before insurance took over, and I paid $7K instead of $96K. Scary stuff.
At Dave McGill 07Z wrote,
If you did not provide or put monies into a healthcare program, then STFU. This nation owes you nothing. That is because you are nothing. The responsible people work and support the healthcare that they require those that don't suffer the realities.
At Durango Bread wrote,
I recently called up a doctor for TIF procedure for my chronic acid reflux. I say I can pay out of pocket. I'll pay up to $20,000. She told me, sorry, we usually only treat people with insurance. We charge about $100,000 to people who have insurance. You should consider getting insurance. And after a few months, come contact us again. I was like, damn it, it's a scam.
At Zoe 24 wrote,
Bad thing about certain states like Massachusetts is that you get fined each month $200 plus. You're uninsured if your income is higher than $20,000 a year. Even if you're perfectly healthy, don't use emergency services or go to doctor visits.
James Williamsburg 6152 wrote,
I mean, we pay so much in taxes in everything we buy and sell groceries. Traffic tickets. Why should we have to have anything taken out of our paychecks?
Acadie 5 Fan 737 wrote.
3 years ago, I had to get a CT scan and didn't have insurance. The price was $2,400 to $2,600 depending if I needed contrast. I told them I didn't have insurance and they gave me the cash price, which was about 25 to 30% of what they quoted. I paid about $625. A year or so later, I was supposed to get another one, and this time I had good insurance that was about $900/month, but it had a $9,600 deductible. So had I had the scan, I would have been charged $1,040, 40% of the price. If I wanted insurance to pay for the full amount, I would have had to already met the $9,600 deductible plus the $900/month, which would equal $20,400 per year after tax. This means I would have had to make $27,200 to cover all these medical costs. I recently had a car accident hit a deer. I haven't had a claim in 29 years and had the same company for probably 23 to 24 of them. They have been fairly bad to work with. They aren't denying the claim at least, but it could have been much smoother and there are some questionable things going on with the valuation and estimate. If I would have invested the dollar I paid in insurance, so 30 years, I'd have well over $500,000 in the bank, probably closer to $800,000 plus if I recall correctly. Add in all the medical insurance fees, and I know where all my retirement dollar has gone.
At the 4th Reich wrote.
The bald guy is the exact problem in this country. Despite all the evidence to the contrary, he thinks the US government is honorable enough to run healthcare in the country.
At Master Driver of Toyota Super 4164 wrote.
Released COV-D take out the elders, pension and SS bubble. Push the jab on everyone without long-term review. Then increase insurance premiums so that when ultimately more and more people start to develop health conditions because of it. They're trying to cover it up so hard right now, you're FK'd. Greatest most egregious con since 9/11. Everything is a rich man's trick.
At Me John the Don wrote.
I wish my employer would just give me what they waste on my healthcare. It goes up every year and is now like $15,000 per year, and I will not ever utilize that. The healthcare company is looking for like a 20 to 30% increase to be authorized too. Similarly, I wish I could control my own Social Security payments and pay myself and invest. They will never give you the value of what you contribute. Let the credits fail. Make the industry actually be competitive. Executives in healthcare should be number one limited to 2 to 3x the median income at their company. Limit all costs to no more than a certain range of median wages. We need to tie everything to incomes to offset all the mommy printing. Then all business would only be able to exist by forcing the money printing to stop.
At Marcus McNeil 1987 wrote.
Everyone who says "Fook healthcare, good luck paying for your bill without it. And pray you didn't have a serious issue. It saved my life and my girl's life, and we're not in debt. Saluter 313 Healthcare. Jack, you're the man.
At the Vanman 4498 wrote.
It doesn't cost us Canucks half our paycheck. You Americans are treated poorly. Our taxes are higher, but we sleep well knowing medical and dental coverage for all is the norm. Still think the US is the best.
At Joseph Wildberger wrote.
One of the reasons why your healthcare cost is so high is due to the fact that some infants will bleed to death after circumcision, and a botched circumcision payout is $20 million.
At Integral Eric wrote.
Except for when emergencies occur. Relying on the modern healthcare system for optimal health is stupid these days, especially because that system is built on a big pharma model of treating symptoms, which creates more symptoms to treat for life. Recurring customers is the name of the game. Why don't you just take responsibility for your own health instead of delegating that responsibility to someone who makes money from you being chronically ill? Educate yourself. Become your own doctor. Put your health first before partying on the weekends and driving that high-end sports car. And invest the money you usually reserve for luxurious modern living and entertainment into your health too. Become the greatest version of yourself you can possibly be, as well as live long enough to fulfill your full potential.
At Adnelson 9763 wrote,
Universal healthcare in other countries pay about 40%, but that it's still much less than your taxes here plus insurance costs, co-pays, deductibles, etc. will be much more than that. And you will still get a bill. Actually, lots of bills. Months after the fact.
At Adnelson 9763 wrote,
Not paying medical debts will result in your credit being destroyed. This will work against you when trying to get a place to live, a job, a car, credit of any kind. You will be burned. And if you own stuff, they can force you to lose your hard-earned assets, if you have any.
At Big Jake 4598 wrote,
I have my insurance appointment Tuesday to go over my benefits, make any changes, etc. I know my payment will be higher this year, probably $200, $350 a month. Plus, I have to pay some out of pocket when I go to the doc and pay the rest on my tax return, which is usually a big chunk of money. I'm debating canceling it, however, I am obese and have sleep apnea and high blood pressure. I'm going to the gym and trying to eat better to fight this. I just don't know if I should cancel my insurance with the problems I have or not.
At FLX MNSTR 9549 wrote,
In California, it's mandatory, and if you don't get insurance, they will find you, and it will be added to your state tax return. Fine is $1,000 the first time. I used to be about $600, now $1,000 the first time, and then it goes up after that. If you don't pay the second year, they take your yearly income and multiply it by a factor, and it will come out more than $1,000 depending on how much you make.
At Sherry Thomas 8149 wrote,
Just one of my husband's prescriptions cost $18,000/month. Annual household income about $75,000 with standard employer health insurance. Our medical expenses overall are significant and we receive no GovT assistance. We are 54 and 59. We do not smoke or drink. We very rarely drink soda and rarely eat out. I couldn't see us getting our medical needs cared for very well without the insurance.
At CGYX8 New wrote,
Obamacare was set up by Obama to ENDI in 2025. That is the way it was created from the beginning. Insurance companies are leaving Obamacare, and it increased the USA debt by $16 trillion since it was created. Insurance is expensive.
At STQL3VH wrote,
A private hospital can turn you away at the door, or look at you in ER, put a Band-Aid on it, and turn you out. You cannot be turned away from a public hospital, but they can actually have not one empty room for you. Some are covered over in patients who sue the county hospital. That's why little rural public hospitals are melting away.
You Can Call Meadon wrote,
I was born 1961. As a child, I had good health care through my parents. As an adult at age 18, no insurance. I did not have insurance until age 36. And then I finally got a job that provided health care. I will be 65 in August. I have been paying $1,080/month and slightly less since I retired age 57. I have to say it's a drain. We shall see what the new rates are for 2026, but I might just roll the dice for the 8 months and wait for Medicare to kick in. I hope the rate does not change much. I would rather play it safe.
At Odin 823 wrote,
Is Amazon going to give free healthcare to its robots or H-1B visa holders? Fun fact, Isnotriel has U.S. taxpayer-funded healthcare. We pay for other counties to live the American dream.
At Dohair 879 wrote,
The military is looking better and better every day for young folks. We have the lowest plan for a family with a $6,200 deductible that covers 100% after it's met. Premium is $240 more for medical, but the best part is we have an HSA, so that is tax deferred, and we do the max. I think everyone should all have an HSA personal option and be able to have that tax credit. Add what you can to your own account, then use that tax-free on medical. Just my 2 cents.
Seaview wrote,
The way it works in my household is I make the money for the big bills, and the wife works a lower paying job. But good health coverage for the both of us problem is most are not in a marriage for this idea to work for them. When you get older, you will be on some med that has an overinflated price.
At LTLMSCRL wrote,
Some of the wisest advice I've ever been given, thanks Mom, is that health insurance should be priority #1 when looking for a job. I don't bring home as much money as I could doing something else, but through my employer, I only pay $80/month for pretty good health insurance. Make good choices, kids.
At Necto34 wrote,
I'll take higher taxes and universal healthcare over this bullshit that's happening in this country. All these corporations, insurance companies, and especially insurance companies, have way too much power, too much presence. It's just wrong. This country is not for people, it's for corporations and the ultra-rich.
At Give Methamusic wrote,
The entire reason why healthcare in the US is so effed up is because of progressively increasing government involvement in healthcare over the last 60 years. Importing 25 million immigrants over the last 4 years definitely did not help either with regard to healthcare costs.
As Wakmakoni wrote,
If you don't have insurance, you should tell the doctor's office beforehand and ask to see the price of procedures before going in. If they aren't transparent, shop around until you find somebody who is.
At Just Joggin QB9yo wrote,
Dentist is another scam. I clean my own teeth and haven't been to a dentist since 1997. I have all my teeth. They are not discolored, and I have never had a cavity. Take care of yourself.
At I'm the Rum in the Punch wrote,
I just did open enrollment as a single person, and it was very reasonable through my company. Dental and optical and even legal services included. I pay less than $100 every 2 weeks. I wonder if this is a bunch of fear-mongering.
At First Last ZW8IP wrote,
I think perhaps many healthy young males can opt out of healthcare insurance fairly easily. Unless you make a habit of riding motorcycles and rock climbing and such. Though car accidents can happen to anybody, your mileage may vary. See what I did there? Etc. It is tougher for women who have to worry about things like unplanned pregnancies. And children really complicate things. I went without health insurance for a brief period between jobs, and one of my children decided to borrow the neighbor kid's trail bike and run into a park bench. It could have been worse, but she is left with a scar on her leg, and I barely kept the bill collectors away whilst all of us had to eat ramen for the duration. Hopefully by the time my eldest grandchildren are 25, we will have a different political situation.
At Mealy6140 wrote,
In Russia, we don't have welfare in the way it is in America. Everybody has to work and pay taxes. If you don't want to work, it's fine. It's your choice, but you don't get as much of government assistance as people get here in the USA. Doctors in Russia don't make 6 figures like they make here. Therapist, orthopedic, etc. It's a good job, but they can't diagnose you without made-in-China scans. What would they get 6 figures for? It's different with good surgeons though. BTW. We don't have medical assistants, neither we have teacher substitutes or whatever they are called. Everybody works, pays about 20 to 30% taxes, gets free medical care. Same taxes as you pay here, but they are used toward to working people's medical care instead of welfare. If you want a faster care, you can go to a private clinic at your own expense. The government does help you if you have kids. They help, but they don't cover all your life expenses. If you are not able to take care of your kids, the government will take them. It's that simple. Children don't have to suffer. There's a better help to those who really disabled.
At STQL3VH wrote,
I'm over 75 and quit my health ins in 1989. After an argument with my DR. Told me to rush to the hospital for an immediate heart operation, which he would not even come to the phone to tell me. His nurse finally told me to get me to drop everything to go. I absolutely did not go. Must be the heart crap didn't pan out, cuss I'm still here. IFYO, you are NOT6/ have real issues, use common sense and be proactive. Your health. Learn how your own body works, learn what is bad, good for you and act accordingly.
At Aminomnum wrote,
No, in the UK we don't lose half our paycheck for free healthcare. Also, I still have private healthcare in the UK, half paid for by my work.
At Ed Hammond 6911 wrote,
My wife and I pay $800 for our Medicare and a supplemental, which you have to have, or you get stuck with huge bills with no dental insurance. I always thought Medicare was free. No, Medicaid is free. It's for bonds and welfare people. Then guess what? If you go from Medicare to Medicaid, they pay that too. So really pays to be a degenerate in America.
At Honda K24Z7 wrote,
Mexico has an entire city devoted to dental care. Look it up. It actually makes more sense than paying the US costs for the same or similar work.
At Arnold Ziffel JW2MV wrote,
We had health insurance but never got actual health care because doctors ignored my complaints until my appendix blew up and the pain was unbearable. But those who go without any insurance rely on us taxpayers if they get into an auto accident or whatever. At least get some kind of insurance. The bills could cause you to lose your mind and destroy your credit and lifestyle.
At Alameric 5534 wrote,
You are on insurance because you are afraid something is going to happen. Yeah, no ST Sherlock. That is what insurance is for. You buy it to reduce risk. FYI, hospitals cannot turn you away, but they do not have to fully treat you either. For example, let's say you found out you had a heart problem. The hospital will treat it with medication rather than actually fixing it with surgery. Also, the more people who do not have health insurance, the higher the price will become. This is why universal health care is cheaper, no profit motive, and better. Everyone pays into it, and therefore it is funded. Health insurance, the more people who drop it, the more the company has to charge the people who have it in order to cover the people who need it and profit off it.
At Joe Frasciani 8693 wrote,
38T debt and taxes out of control, yet you all want more. Gov cheese instead of addressing the real issues with healthcare. You all deserve the increases. Maybe now you'll start to pay attention to your elected officials and their absolute incompetence at all levels. 23 million. Gov employees with healthcare you can only dream about.
At Resolution 6272 wrote,
Amazon is a virtual thing and only covers 30 common conditions. It's also 29 PO in T00 text message visit or 49 PO in T00 video visit. This is most def not an answer.
At Don Shell wrote,
643 The tax credits that are expiring are because they were from COVID money. If people understood it more, then they'd be fighting for the right thing.
Catalina Foya wrote,
9 Jack and Nestor, please look into the abhorrent issues surrounding being an organ donor. I'm serious when I tell you it's shocking. Retired organ transplant surgeons are speaking up. Major life-threatening accident. Organ donor equals less likely to receive proper medical care to save your life. I'd love to hear your take on this, as many people DONOT know.
At Daniel Gutuescu 5321 wrote,
Just don't go to the doctor. Let's see how all this mafia, so-called doctors and insurance co. will make money without customers. I went to the doctor twice in the last 18 years, and for denture, I am 73. I took a trip to Europe and paid 25% or less of what I will have paid in US. Get smart or shut up and swallow.
A British Rain wrote,
I'm from London and I can tell you that the deduction for healthcare in the UK is nowhere near 50%. If you earn between 12K 50K, you contribute 9% off your monthly salary. America has terrible healthcare system. Mix that with toxic food. You guys are fucked.
At Larson Family Farm LLC wrote,
First homeowners insurance is collapsing. People opted out. Now, people are opting out of health insurance collapsing. Kudos to them. From 1900 to 1960, there wasn't any health insurance or even much homeowners insurance. We lived without those and people did just fine. They sold us on fear. Insurance companies are scams.
A Don Shell wrote,
246. The thing people aren't realizing is nothing is changing. The issue is the money that was helping expired because it was COVID money. So in case we don't remember, COVID is over. What we need to do is get Congress to do their job and work on better negotiations with healthcare companies. But they're not going to because the lobbyists has paid them off. ObamaCare is the issue. It didn't help anything. It didn't make anything cheaper. It literally is a funnel to get people on Medicaid.
A Coach Goody 421 wrote,
Your math is terrible. It's 4% more tax for healthcare on Medicare for all. They did the math already. Would save 67K lives. No one gives a shit if the rich have to pay more. That person makes 65K a year is gonna have to pay $964 a month. It's gonna be way more expensive than just 4% tax.
A Jonathan Bulkheed 338 wrote,
I'm a network engineer for a healthcare organization. It isn't just highly encouraged to work OT, it's basically a requirement against your will. My normal week is 68 hours. My on-call week is 80 plus hours. My OT alone is more than my regular pay every week, even after taxes. There is more money in healthcare than you can imagine. They will gladly pay out an extra couple of $1,000s to an engineer every week just to keep equipment up and running, especially when that equipment makes them hundreds of thousands per week.
At Edward Sodk 5860 wrote,
Germans pay the same amount of tax as Americans for social welfare, social pensions and government medical care. The difference is they pay 1% in T 5% of GDP for defense. Now that Trump demands they pay for defense, MERS shut down the social welfare benefits. YOUALE, ALIRE ANDDO, NOT portray facts correctly.
That the Feel button wrote,
Health insurance is just financial protection but provides no health benefits. If you don't have it and end up in a hospital, especially if you're unconscious, they will take all your assets. Cheers, Jack.
At Ryalpita Mama wrote,
Catastrophe insurance, Christian healthcare ministries, direct care doctors, etc. Jack calling me out with a Diet Coke, bro. I will have you know it's supposedly safe for diabetics. But for real, my blood sugar meter says it raises my blood sugars a smidge. Now tea homie. Tea herbal or black does nothing. Water. Water makes my blood sugars lower. I am sorry you were a Make-A-Wish kid. You can be sued for medical debt. I was for years.
A Show Me What I Need to Know wrote,
To buy a plan on the open market, it would cost me over 7K in premiums and 7K in deductibles every year, before the insurance company would start paying for anything. Who can afford 14K a year, year after year? I have to risk going without insurance at that cost.
Ed Omnomnum wrote,
Richest country in the world. Every other poorer country has nationalized healthcare, but you get a multitude of comments saying it's communism to have free healthcare when one mentions it. But your country has trillions of dollars for World War III, which will never happen, yet doesn't give healthcare to its dying, obese, aging population. Shunning the alternative as communism is reductive and stupid. Anywhere else in the world, if a doctor asks for money when your child is born, they will get beheaded for even suggesting that. There's no good politicians to vote for there. Luigi was right.
At Thorvald Torgrimson 5651 wrote,
I've been in the trades for 37 years. I have outstanding insurance, and it is paid out of my wage package. Work union, work hard, and show up early every day. Jumping job to job is a death sentence.
The Thomicider 9841 wrote,
Totally different circumstance, but I had a storage building I was paying additional insurance on for theft or vandalism. I had $10,000 worth of tools in there. Sure enough, it got robbed. Now the insurance says they won't pay for anything I don't have receipts for. I bought these tools 20 years ago, so they're paying me nothing. I even have pictures of the tools and toolboxes, but no receipts. So now I'm going to have to sue the insurance company after paying them for 5 years and never having a claim until now.
Eduvu14 wrote,
And get a job that offers benefits or pay for private insurance. Also, ObamaCare or whatever it goes by now is still available. Whining on the internet solves absolutely nothing.
At Nilia Maria wrote,
As someone who has an emergency appendectomy 5 days ago, this whole situation is terrifying. I'm 33, mom of 3, in good health, and we had a good affordable plan through the ACA. If I hadn't known the ER visit wasn't going to bankrupt us, we've already had one medical bankruptcy a decade ago. I may have waited a day or two to seek help and literally died, leaving my kids without a mom.